I'm Dr. Jason Cundiff. I'm a board-certified otolaryngologist who is a surgeon who specializes in the medical and surgical management of head and neck disorders. I'd like to take this opportunity to discuss tonsillectomy and adenoidectomy. These procedures are some of the most common procedures performed by the otolaryngologist. There are several reasons to consider tonsillectomy and adenoidectomy. The two most common are recurrent infections or enlarged tonsils and adenoids, which cause breathing disorders. In the case of recurrent tonsil infections, we begin to consider tonsillectomy beneficial if an individual is having 5 to 6 sore throats per year or 3 documented strep infections a year. In the case of enlarged tonsils or adenoids, we begin to consider tonsillectomy and adenoidectomy for individuals with mouth breathing, snoring, and particularly those who pause or stop breathing at night, which is known as sleep apnea. This is a very common problem in pediatric patients, and this lack of sleep can lead to hyperactivity, behavior problems, difficulties in school, and even bedwetting. Tonsillectomies are also performed for asymmetric tonsils to rule out cancer, and for recurrent peritonsillar abscesses, which are infections that build up behind the tonsil. Tonsillectomy and adenoidectomy are performed under general anesthetic and are usually performed as an outpatient. The procedure usually takes 30 to 45 minutes, and the major risk of surgery is bleeding, which can occur anywhere from the first day of surgery to up to 2 weeks. If a tonsil bleed does occur, some individuals actually have to go back to the operating room to control the bleeding. Most individuals have a severe sore throat for 1 to 2 weeks after surgery. Some individuals are actually not able to eat real food, and for several days after surgery have to rely on popsicles and fluids to stay hydrated. Most people require 1 week off of school or work to recover and should not do any strenuous activity for up to 2 weeks after surgery. If you'd like any further information about me or my practice, please feel free to check me out at my website at www.jasoncundiff.com, or you can also find me on Facebook at Dr. Jason Cundiff.